Top of the morning, Dan and Amy. The controversy over how COVID-19 deaths are being recorded persists, even though, to be clear, the CDC has been clear. And so that has filtered down to the state level, too. Dr. Ezeki here in Illinois, Department of Public Health, saying, hey, essentially conceding the point at a press briefing last week that you could jump off the Willis Tower, hit the ground, the medical examiner could find out you were COVID-19 positive, and that counts as a COVID-19 death.
Right. That's been my point of contention all along.
And
Because I had a friend whose mom died of cancer, and they put it down as a COVID death, and they were pissed because she died from pancreatic cancer. And they want that recorded because it helps with, generating research funds and things like that. And they didn't want her just to be lumped in as a COVID death because she was in hospice and they knew, the time was coming.
So you can argue about how it should be classified, but you can't argue transparency because the CDC has promulgated rules for all to see. You don't have to test. If it looks like COVID-19, it is COVID-19. And that has, as I said, filtered down to the state level where Pritzker's administration has been similarly transparent. Now, I don't know that that has penetrated people's consciousness such that they look at the rolling tickers of the number of deaths, 63,000 plus in the country at large now, and discount that in their minds to some extent because of the comorbidities in the overwhelming majority of the deaths. I don't know if they do that or not.
But the presumed death is what, also, we have a friend who owns a funeral home. The 83-year-old dies at home alone from a heart attack, had previous heart problems. COVID-19, they didn't even test them. That's my problem.
I think that's what I just said. The CDC has said those are the guidelines.
Right. But the CDC, did they change the rules during the middle of the game, or that's...
They promulgated rules about this specific virus and deaths associated with the virus. The question becomes, should we be making public policy based on the ticker of death, or should we be breaking down those numbers so that we have texture to that number and then add texture to our public policy making? They want us to argue this issue of is that a COVID-19 death or a cancer death? They want us to argue that. So don't argue it. They want us to argue because it sounds like, oh, we're heartless and it doesn't matter. Somebody that they were COVID or they look like they were COVID and people died and we're in the business of saving lives. Me too. I'm in the business of saving lives best we can. And remember, it's not lives versus money. It's not lives versus data. And you don't save lives. You trade lives. It's some lives versus other lives. Nobody is saving lives except medical professionals, like one at a time. Policymakers are trading lives. Policymakers are trading lives. We're so bad at framing this conversation. We fall right into the trap that CNN and MSNBC and these Champagne Leninist governors like the one in Illinois want us to have. Stop it. Think through what they're trying to get you to do and stop having conversations about important public policy and quality of life as well as preservation of life on their terms. It is interesting to note, just in terms of effectiveness, that Florida and Texas did everything wrong, right? And California did everything right. We were talking about that earlier in the show with respect to Elon Musk's review of Gavin Newsom and just the general imprison in place orders. Texas and Florida, 3 deaths per 100,000 and 6 deaths per 100,000, respectively. California, 5 deaths per 100,000. No material difference.
None, yeah. And look at how differently they lived their lives.
But Illinois, we're supposed, and Virginia, and Michigan, and North Carolina, an extension of a shelter-in-place order there till May 8th. Based on what? Based on politics. That's what Roy Cooper has to fall in line. Because Jared Polis and Gina Raimondo, these are sort of independent-minded Democrats. They don't have to follow the herd mentality. These other governors that are more reliant on the party superstructure, they got to toe the line, like Roy Cooper in North Carolina. by the way, New York State, to the point of the classification. New York State, deaths in New York State mid-March through mid-April. In 2019, deaths from heart disease, cancer, accidents, stroke, Alzheimer's, flu, homicide, north of 12,000.
In a month?
Yes, mid-March through mid-April of last year. In 2020, the deaths from all of those conditions I mentioned is about 4,000, and COVID-19 is 13,000.
Yeah, you tweeted that out, that graph.
Classifications.
Yeah.
Classifications. Okay, so we have the classification. Now the conversation begins. That's not the end of the conversation. And let's continue the conversation with William Briggs. He's statistician to the stars. He's a writer, a philosopher, itinerant scientist. Okay, very good.
I like statistician to the stars.
I like itinerant scientist. He's got a lot there. And his blog is wmbriggs.com. He joins us now. William Briggs, thanks for joining us. Appreciate it.
Thanks for having me. Nice to be here.
Good to have you. And you posted a piece this week, robbing the cemeteries to pad death totals, which is sort of what we were talking about. But give us the particular data points that struck out to you with respect to the sort of robbing the cemeteries observation.
That's pretty much everything you said was exactly on the money. The one additional point is to calculate these things, to really know these things, besides just looking at the death certificates. Normally, nobody knows how many people die of the flu each year. Just nobody knows that number because the flu is not coded on all death certificates. But we see every single winter season a spike in the overall death rates. It's regular as clockwork. And so what they do is they use a statistical technique called excess deaths. It's very morbid,
right.
But they just fit a sine wave, this common signal, to the peak that we see every year, and anything that sticks up above the model is classified as a flu death. And so what they're doing now is some professors at Yale said, the models that predicted the number of coronavirus deaths said we should have it much worse by now. Therefore, we should, yet the death tolls of those classified as dying from COVID, even though it's not dying from, it's dying with or dying with suspicion or just plain dying. They said, that's not enough. We need to make up this gap somehow. So maybe it's the case that these excess deaths that belong to the flu, some of these might be better classified as coronavirus deaths. So that's what we're going to classify them as, possibly. Now, I don't know if the CDC has taken that suggestion yet. It's out there. They might try to do that because, look, originally the forecast model that they made early on, back in February, was that 2 million Americans were going to die from this. 2 million. Now, they never looked at this very carefully, but the people who made that model didn't even think it through. They said, in effect, if you adjust it by population and everything, that coronavirus was going to be deadlier than the Spanish flu. And the Spanish flu killed anywhere up to, 50 million people, plus or minus, across the globe in 1917. And somehow this virus was going to be deadlier based on no evidence except for assumptions that they put into a model. And then the government said, okay, well, all right, we're going to believe that model. That model is true. And therefore, that model says if we lock down, we're only going to get roughly, anywhere from 100 to 200,000 deaths, something like this. Okay, but that believes the model. The model says to implement these activities, and we need to believe this model because the model was created by all these experts, and they're very smart guys, and they are. Therefore, the model must be true. So now they're going back and seeing that the model wasn't true. The model is a completely blown forecast. But they still believe the model because the model seems plausible to them. Of course lockdowns work. Why wouldn't they work? Well, that's the question. Everybody just assumes that they work. That may not be the case. But they believe it is, And therefore, to make up the gap, they have to go back in the data and find deaths that would otherwise be ascribed to the flu and assign them to coronavirus.
Right.
That's a long, tangled, complicated thing because it's not simple as counting. We can't just go back in the death records and look at everybody who died of flu because a lot of doctors don't code it as flu. They'll code it as pneumonia. They'll code it as something else. They'll code it sometimes as flu, but sometimes not. So that's why you have to use these statistical techniques.
And that's
to
why,
estimate
and that's why in the flu deaths we get wide ranges. You know, the flu deaths were anywhere between 24 and 62,000 this year, for example. So that's one of the reasons we get that, is what you're saying. Well, so on the excess deaths, it's interesting because we talked to a researcher from Leiden University in the Netherlands about this earlier in the week. He's doing excess deaths modeling too, and we mentioned that Yale study that you're referring to. There was a caveat in that Yale study, as I think you just indicated, which was this: we're not sure, but it's kind of one of those. But you've got this New York Times piece, 46,000 missing deaths, tracking the true toll of the coronavirus outbreak. The Yale researchers, the Netherlands researcher we talked to, unsurprisingly, the New York Times, are all suggesting the excess deaths, which we can't identify in terms of cause, are more likely than not to be mostly COVID, and so the death toll is actually much higher than is being reported and not much lower, as some are arguing.
And I'll tell you why we know that's not true. Because all you have to do is plot up. This is the best statistic you can look at, because we have this huge dispute. And, there is suspicion over some deaths. Is it COVID or isn't? Who knows? Let's instead look at all deaths. All deaths. So we're going to count all deaths. We're going to plot that up by week. The CDC has data available going back to early 2009. We could just look at that. We could plot those up. We do see the usual flu bump that started around, or not started, but peaked around January, as it always does. But it dropped abruptly. It wasn't a very big flu year. And then we do have a peak, a secondary peak forming in March and April, that is surely partly caused by coronavirus. There's no doubt that this virus kills. But if you look at those data, and compare it to historical times, the 2000, 2017, 2018 flu year was worse. It was worse. There were more people killed.
No question.
There was more people killed. There was no panic. And that's just here. That's just here in America. The 2012, 2013 flu year looks like it's going to be about equivalent to the coronavirus. And so with the 2014, 2015 flu year,
well,
it's going to be about equivalent. Not exactly. The coronavirus will probably beat them, but not by much. And it doesn't look like it's going to beat the 2017, 18. And that's only looking at data back through 2009. If you go back into like the 57, the Asian flu, the Hong Kong flu of 68, these were much, much worse, with no panic, no global panic, no lockdowns, no frenzy, no arguing about flattening the curve, not everybody losing their minds. And this is a very unique event. Not that virus, we get unique viruses every year, otherwise people wouldn't be dying of the flu every year. This is unique in the sense of the global reaction or the overreaction.
Yeah, people's livelihood is dying. But let's talk about what the true infection rate is.
Well, nobody knows. There's no way to know this. You could sort of look at data. You could look at there's a very good plot that you could look at. You just look at the total number of reported cases. And you look at the total number of reported deaths. Now, these are reported because we don't know the true numbers. And you divide the deaths by the total cases. And in the States, you get a value of around 5%. Meaning it says everybody who's infected with this thing, 5% of them died. Now, there's no way that that's true.
Right.
No way that that's true, that 5% of the people who are getting infected by this die. Because we have other studies, like the recent study done in federal prisons looking at the infection rate of people who are truly locked down. And we have other cases like the Diamond Princess and so forth, cruise ship. We have other data that are based on rational sampling plans. And the death rate for these people are much less. The case fatality rate is much less than 1%. Okay, but assume it's as bad as 1%. The 5% is not true. That means we're not counting all of the actual cases that exist. We're missing quite a lot of them. We're missing at least 80% of them. This virus has spread much farther than the data indicates. And not only that, this is the bad part about that. We know it must be the case that the virus is much more widespread, just looking at these simple numbers. But as you increase testing, what's going to happen is this. You're going to increase testing. Testing is going to ramp up, and that's good. Testing is good. But you're going to see the case numbers rise. And they're going to use that rise in the case numbers to say, my gosh, look at this. It's worse than we thought.
Right.
And no, it isn't worse than we thought. It's actually much better than we thought, and must be, because 5% of these people are not, everybody infected are not dying. So we're grossly overestimating the fatality rate and grossly underestimating the infection rate.
He is William Briggs, statistician to the stars, writer, philosopher, and itinerant scientist. His blog, wmbriggs.com. William Briggs, thanks so much for joining us. Appreciate it.
Thanks for having me.
Take care.
And he joined us on our turnkey.pro answer line.
This is the morning show more Chicago radio listeners are choosing. This is Chicago's Morning Answer on AM 560. The Answer.
A business needs to be built on a great foundation, one with the framework of integrity and tradition. Chapel Design Build delivers just that, providing design build and general contracting services using Butler Steel Building Systems. Their projects dot the landscape from O'Hare to DeKalb. You see their work in office and warehouse additions, recreational facilities, large-scale distribution centers, and manufacturing plants all over northern Illinois. Partnering with Butler Steel Buildings, Chapel Design Build has developed an extensive subcontractor base and valuable market knowledge to get your quality-built project completed on time and on budget. Ensuring your project is a success for your business and one that